Hello, my name is Jacob Fusen. I'm a student of the University of England. This presentation is for pathophysiology over a syndrome of my choosing. This is a note card with my name and presentation topics. The syndrome I have chosen is nephrotic syndrome. This is when the blood vessels and the glomeruli are damaged, resulting in an increased protein excretion in the urine, specifically albumin. The clinical manifestations include weight gain due to fluid retention, your pee looking foamy due to the protein in the pee being excreted, swelling, anorexia or loss of appetite, and fatigue. Other syndromes impacting the urinary system include urinary obstruction syndrome. This is a partial or complete blockage of the urinary tract. This decreases urine production either completely or to a great degree or some degree. It can lead to kidney stones or kidney infection or damage. It is different from nephrotic syndrome because in nephrotic syndrome you still maintain a level of excretion, however your pee contains protein. In urinary obstruction syndrome, the excretion level is decreased. Next, acute renal failure syndrome is a rapid onset of the decreased waste filtration capacities of the urine. This results in fluid retention, decreased urine excretion, swelling, confusion, and fatigue. This is different from nephrotic syndrome because in nephrotic syndrome, protein is being released. Protein excretion is happening, and excretion of urine is still occurring. In acute renal failure syndrome, waste buildup is occurring, less urine is being excreted, and it can lead to more dire consequences. Chronic renal failure syndrome is a gradual decrease in waste filtration capacities of the urine. It also results in fluid retention, initially just changes in excretion levels. However, towards the end result, it will be a decrease in excretion levels. It also causes swelling, confusion, fluid retention. It's different from nephrotic syndrome because it's more severe. Waste buildup occurs rather than just protein being excreted. Some diseases associated with nephrotic syndrome are minimal change disease. This is a disease most commonly impacting younger children, ages 2 to 6. It is caused by infections, drugs, or allergies damaging the glomeruli, increasing protein excretion. This is a potential cause of nephrotic syndrome. It can lead to nephrotic syndrome. Another disease associated with nephrotic syndrome is chronic renal disease. Nephrotic syndrome over time can damage the glomeruli or the kidneys, resulting in decreased waste filtration capacities. At a certain point, it moves beyond the stage of just protein being released in the urine, and waste buildup occurs, and the chronic kidney disease. Again, symptoms will be fluid retention, swelling, fatigue. This could eventually lead to renal failure or even death. Transplantation would be required from another kidney. Another disease associated with this syndrome is acute kidney injury disease. Nephrotic syndrome, again, can damage the kidneys. Sometimes this can occur rapidly, especially if there's a complication involved. This leads to a rapidly decrease in the functionability of the waste filtration capacities of the kidneys, resulting in fluid retention, waste buildup, fatigue, and this could quickly lead to death, and actions must be taken quickly to halt this process. This concludes my presentation over nephrotic syndrome. Thank you for listening.